Welcome to a program featuring interviews of state and federal candidates and incumbents from districts serving Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I am Gussie Brown, Advisory Council member of Northwest Senior and Disability Services Senior Advisory Council. I want to welcome candidates, incumbents, and Advisory Council members to this year's candidate interview, which is sponsored by our Senior Advisory Council and our Disability Service Advisory Council. Northwest Senior and Disability Service is a local governmental organization that contracts with the state to provide Medicaid, Oregon Project Independent, and federal Older American Act funded programs. The mission of Northwest Senior and Disability Services is to promote dignity, independence, and health, honor, choice, and empower people. Assistance provided includes, but is not limited to, long-term care and services and case management, hot meals, including home delivery meals, information and assistance, supplemental nutrition programs, formerly known as food stamps, protective service, home admission screening, insurance review, and emergency assistance. Because of the number of state legislative districts that our service area cover, we want to invite a large number of candidates to our candidates interviews. Each candidate have been provided with information about the format that will be used in these interviews. Each candidate will be introduced by a member of the Advisory Council. Then, each candidate will have the opportunity to answer these questions, which will be timed.
I'm Ruth McEwen from Northwest Senior and Disability Services Advisory Councils, and I'm interviewing Suzanne Bonamici, who is a Democratic candidate running for U.S. Congress District Number 1. Will you support the reauthorization of the Older Americans Act, including the appropriations necessary to fund the programs at a level that would, at minimum, keep pace with inflation?
Thank you so much, Ruth, for that question. Yes, I do support the Older Americans Act. In fact, I have introduced a reauthorization of the Older Americans Act that I wrote after meeting with senior groups here in Oregon. The reauthorization that I've introduced strengthens programs like elder abuse programs, makes provisions for better senior centers, has specific provisions for LGBT seniors, and in general updates the Older Americans Act to make it stronger and better. And I support the legislation as well as the appropriations because of the importance of making sure that our seniors have the services they need and deserve.
Thank you. How will you support flexibility within the Medicaid and the Medicare programs that will allow Oregon to continue to be a leader in providing innovative programs and services to seniors and adults with physical disabilities?
Thank you so much for that question as well. And I want to say I'm proud to have earned the endorsement of the Association to Protect Medicare and Social Security. I'm very proud of that. I want to say that it's very important here in Oregon to have the flexibility that we need so that Medicare and Medicaid recipients can continue to receive the health care and services that they have earned. Medicare and Medicaid are earned benefits just like Social Security, and we have to make sure that our seniors and those with disabilities have the services that they have earned through those programs. I want to make sure that working with our state partners and our providers here in Oregon, we can maintain the excellent services that we have seen through healthcare transformation and Medicaid expansion. I will not vote to cut Medicaid, Medicare, or Social Security, and I have not in the past and will not in the future.
Thank you. And how important is it to you to end the federal budget sequestration mechanism negatively impacting the services and programs which help seniors and people with disabilities maintain their choice, dignity, and independence?
Thank you so much for that question, Ruth. I was not in Congress when the Budget Control Act passed that put the sequestration into effect. It is bad policy to have those across the board cuts. That is not a good way to decide where we should be cutting programs, and where should we, is not a good way to make policy decisions. So I will do everything I can and have continued to advocate for getting rid of sequestration, ending those across the board cuts, especially as they affect Medicare, Medicaid, and programs that impact our seniors. When I was in the state legislature as well as in Congress, I worked hard on programs like Oregon Project Independence, working hard to make sure that seniors were protected from insurance scams. I have a consumer protection background, and I know that seniors are often targeted for scams. All of those things need to be maintained, and I'll work on those issues in Congress as well as I did in the state legislature. Making sure that seniors have in-home care and can age in dignity in their homes is also very important to me, and one of the reasons why I am sponsoring the reauthorization of the Older Americans Act. But again, back to your question about sequestration, it's a bad way to make policy. We should not be cutting across the board. That hurts our seniors, people with disabilities, and the vulnerable in our communities.
And if elected, what can seniors and adults with physical disabilities expect from you?
Well, they can expect me to continue to be an advocate for seniors and people with disabilities, as I have been in Congress and I was in the state legislature. I'm proud to have earned the endorsement of the Oregon State Council for Retired Citizens, as well as the National Committee to Preserve Social Security and Medicare, and that's because of the positions I have taken in making sure that we do not cut Medicare, Medicaid, and Social Security. Seniors can expect from me an open office and responsiveness when they contact me with concerns, and I'll continue to advocate for their rights. One of the bills that I'm also working on is to strengthen provisions against age discrimination for seniors. I'm working on cracking down on payday lending and other consumer protection issues that affect seniors as well. And again, the Older Americans Act, which I am sponsoring the reauthorization of, is an important program that funds Meals on Wheels, senior centers, and other very, very important programs for seniors. So seniors and people with disabilities can expect that I'll continue to be on their side and be their champion.
Thank you, Congresswoman Bonamici, Democrat congressional candidate for District Number 1.
Thank you, Ruth, for the opportunity to be here.
I'm Jan DeWith from Northwest Senior and Disability Services Advisory Council, and I'm interviewing Jason Yates, who is the Republican candidate running for U.S. Congress, District Number 1. Jason, will you support reauthorization of the Older Americans Act, including the appropriations necessary to fund the programs at a level that would, at a minimum, keep pace with inflation?
Yes, I do plan on supporting the reauthorization of the Older Americans Act. It's been a great help to senior citizens and veterans here in the United States and in Oregon as well. With the problems that have arisen with Obamacare, $716 billion was taken out of the Medicare system to fund Obamacare. We can see that that's already hurting senior citizens now. So I think that one of the main things we need to do is fully fund Medicare to help out, because right now Medicare is serving more than 44 million Americans, and it's costing American taxpayers $432 billion a year, which means that each person in the program is using about $10,000 per person. So if we're able to fully fund this, then we're going to be able to have a healthier population, and there will be better hope for citizens as they move up in age brackets and further on.
Okay. How will you support flexibility within the Medicaid and Medicare programs that will allow Oregon to continue to be a leader in providing innovative programs and services to seniors and adults with physical disabilities?
I think that what we're going to need to do is reach across the aisle, both Democrats and Republicans together, to come up with common sense ideas to be able to work within the program. Because we see that certain things are being pushed into the program that aren't necessarily helping a vast majority of Americans. It was just said that Oregon's Medicaid program is now covering gender reassignment surgeries. Is that going to affect 99% of the population? No, but it's going to take money out of their possible benefits to be able to help them. So what I think we should do is come together, come to an agreement on things that are actually going to help, that are medical necessary needs for young people and senior citizens alike.
How important is it to you to end federal budget sequestration mechanisms negatively impacting the services and programs which help seniors and people with physical disabilities maintain their choice, dignity, and independence?
Well, one of the main problems is that Obamacare doesn't give you the right to choose what is best for you. It mandates certain programs, it mandates certain amounts you're able to use, a huge deductible that you have to pay right off the bat. This isn't just going to affect people with physical disabilities. This is going to affect everyone as they get into the part where they have to sign up for health care. This is mainly going to hurt senior citizens because senior citizens are the ones that are usually living within a tighter budget because they're having to work through their retirement and they're being taxed at the same time. Now they're having deductibles come out for their health care. What I think we need to do is open up health care to make it a free market so that people can buy over state lines. You should be able to take basically the car insurance model and open it up to all 50 states. If you have 50 states insurance companies fighting for your business, your rates are going to go down. If we meet together, both the Democrats and the Republicans, to work on a tort law reform, then we can also get rid of frivolous lawsuits, which will also help healthcare insurance rates go down, which will affect Medicaid and Medicare alike.
If elected, what can seniors and adults with physical disabilities expect from you?
If I'm elected, you can expect someone that will be standing up for you in Congress. I have seen my grandmother and grandfather fall into ill health and not receive the health care coverage that they needed. They suffered the last few years of their life, not knowing where the next payment was going to come from, how they were going to pay their bills, how they were going to pay their health insurance. What you can expect from me is that I'll work together with the Democrats and the Republicans to come up with common sense legislations to be able to fund these programs so that necessary health care can be taken care of. Because senior citizens, veterans, people my age shouldn't have to worry about how their insurance is going to be taken care of. They shouldn't have to worry about where their next meal is going to come from or how they're going to be able to get to the next doctor's appointment. This is a common sense issue that we need to come together and work as Americans on. This doesn't need to be a party line issue. It doesn't need to be Democrat or Republican. What we need to do is come together as Americans, because one day we're going to be in the situation where we're going to need help. Who's going to be there to help us?
Thank you, Mr. Yates. Mr. Yates is the Republican congressional candidate for District Number 1.
Hello, I'm Cheryl Statz from Northwest Senior and Disability Services Advisory Council. I'm interviewing Tootie Smith, who is the Republican candidate running for Congressional Representative District 5. Will you support reauthorization of the Older Americans Act, including the appropriation necessary to fund the programs at a level that would, at minimum, keep pace with inflation?
Well, Cheryl, thank you for having me on your show today. It's a great honor to be here to talk about an issue that's very dear and near to my heart. Of course, I would reauthorize payment to that and put it really at the top of the priority list for funding. This particular program, under the Title III, it's very broadly based, but it can provide transportation services for seniors who need it, Meals on Wheels in their home, disease prevention, a little bit of health care, and the things they need to be vital, necessary citizens that so much of us depend on for our futures. As our demographic ages, these services are going to be becoming more important.
That's very true. How will you support flexibility within the Medicaid and Medicare programs that will allow Oregon to continue to be a leader in providing innovative programs and services to seniors and adults with physical disabilities?
Well, Cheryl, I think the best thing that Congress can do is provide payments to the states and let the states themselves implement the program. I think Oregon has a good start on what to do with our seniors and disabilities programs. As a matter of fact, when I was in the legislature, it was a well-known fact that Oregon was a leader in providing these type of services, especially preventative care, and that kept a lot of people out of hospital lines, waiting rooms, and expensive medical care. So I'm a huge proponent of that.
Good. How important is it to you to end federal budget sequestration mechanisms negatively impacting the services and programs which help seniors and people with physical disabilities maintain their choice, dignity, and independence?
Well, choice, dignity, and independence are, I think, key factors that you focus in on this. I think Congress needs to quit fighting. I think Congress needs to work together across both sides of the aisle, Democrat, Republican, or Independent, and make sure these programs are funded. The sequestration measure, I think, was unfortunate. I don't think it did any good. It may, in fact, cost more money. So we just need to make sure we don't fall into that trap again, and I would not support a sequestration measure to balance the budget or any other means.
Okay. If elected, what can seniors and adults with physical disabilities expect from you?
Well, I've been an advocate almost all my life for this. I was in the legislature. I served on the Ways and Means, Human Services. I've always received their endorsements from the seniors in my district, and I'm doing the same thing right now as a Clackamas County Commissioner. I serve on Adult and Senior Services Council in the county. I also work with our veterans, and that's something that's near and dear to my heart. I've also served on the Brain Injury Association board for 7 years. I was its president for 2 years. And during that, we worked with a lot of seniors and veterans who came home from the war with percussion injuries and brain injuries. So I learned a lot. I learned far more about brain injuries and disabilities than I ever thought I would. So I hope to maintain my service in that. And I will say, in closing, government's role, I believe, is to assist those people who sincerely and truly cannot provide for themselves. Some people call it a safety net. I just call it the right thing to do.
Thank you very much, Ms. Smith. Republican congressional candidate for District Number 5.
I'm Phyllis Rand from Northwest Senior and Disability Services Advisory Council. I'm interviewing James Lurenberger, who is a Constitution candidate and running for the U.S. Senate. Will you support reauthorization of the Older Americans Act, including the appropriation necessary to fund the programs at a level that would be at a minimum and keep pace with inflation?
Well, I am opposed to any federal legislation that is not authorized by the United States Constitution. And the part of the U.S. Constitution that authorizes Congress to do anything is Article 1, Section 8. And as I read Article 1, Section 8, I do not see anything in there that authorizes Congress to provide funding of any kind or services of any kind to Americans just because they are older Americans. So no, I would not vote to, I would not support reauthorization.
Okay. How will you support flexibility within the Medicaid and Medicare program that would allow Oregon to continue to be a leader in providing innovative programs and services to seniors and adults with physical disabilities?
Well, once again, as I read Article 1, Section 8 of the United States Constitution, it does not authorize Medicare or Medicaid. On the other hand, however, Article 1, Section 10, which contains limitations on states, does not limit states from providing things like Medicare or Medicaid. So, from a constitutional standpoint, the federal government should have nothing to do, should not have Medicare, and should not be funding Medicaid. That should, if the state of Oregon wants to do that, that should be something the state of Oregon does. But as a U.S. Senator, I would not be responsible for telling Oregon how to help its seniors. That would be something for Oregon to decide for itself. But Congress, the United States Congress, the United States Senate should not be involved in providing Medicare or Medicaid.
How important is it to you to end federal budget sequestration mechanisms negatively impacting the services and programs which help seniors and people with disabilities maintain their choices, dignity, and independence?
Well, now, I have said up till now that I don't see anything in Article 1, Section 8 that authorizes help to senior citizens. There is one huge exception, and that is veterans. In terms of sequestration or anything else that impedes veterans from receiving the benefits that they've been promised, that is wrong. Our veterans we the people of the United States and our Congress have made a lot of promises to veterans. One of the big ones is that we the people of the United States will provide veterans with the medical services that they need as they age. So anything that would impede that, that is stopping us from providing those services, is wrong. And I believe that is authorized because of their military service. We do owe them a tremendous debt, and that includes providing all the medical services that they need and that we've promised them.
If elected, what can seniors and adults with physical disabilities expect from you?
Well, again, other than veterans, I don't believe that the United States Constitution authorizes the federal government to provide aid or services or money to people merely because they're seniors or have physical disabilities. However, I am a Christian, and I'm a tithe-paying Christian to my church. And so the people who are members of my church and people who are not members of our church who seek assistance from our church, we provide that assistance. My parents are dead, so I'm not providing them with assistance anymore, but my wife's parents are alive. And if the day comes when they need assistance from my wife and I, we will provide it. I believe that the federal government should not be in the business of providing services to seniors and disabled people. It should be first families, second churches, third local communities. The business of charity shouldn't be at the top of the governmental food chain. It should be at the grassroots, as I say, family, church, local communities. And unfortunately, our system of government has turned everything topsy-turvy. We need to return to the type of family, church, and local support that characterized our country when we began as a country.
Thank you, Mr. Lowenberger,
You're very
candidate for U.S. Congress.
Thank you.
You're welcome. I'm Phyllis Rand from Northwest Senior and Disability Services Advisory Council. I'm interviewing Rick Rose, who is a Republican candidate running for House District 32. Mr. Rose, tell us at least 3 of your positions that would make a senior or an adult with physical disabilities encouraged to vote for you?
Well, I think the first one is we're not, as a state, spending enough money on our seniors. I own a care home for developmentally disabled, and it seems that the funding is just totally different for both. And I think that seniors need to be have better chances at more services. And so I think that's one. I think another one is better representation. I think that in the senior homes that I've seen, and actually we've had seniors in our home from seniors and people with disability, I think that the people I've met would like to be heard more. And I think thirdly, I think if we do it right, I think there's other money that we're already spending in truthfulness being wasted in other areas that we could bring over and do a better job in all those three, the other 2 areas.
Regardless of the state revenue forecast, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with disabilities?
Well, I think no matter what the forecast is, we need to spend more money on them. The average in a senior home is anywhere from $900 to, depending on what level, all the way up to $2,100. And I think what you have to ask yourself is, what kind of care are you going to get for that? And I would dare say it's not going to be a quality that we should stand for, or Oregonian seniors deserve better than that. And so I think no matter what the forecast is, there are certain things that we have to do in order to take care of our seniors and people with disabilities all the way across the board. And so, you know, there were some cuts made a few years ago, but I think that's not the area to cut. I think we have 180 state agencies. I'm sure we can find somewhere else to cut. I think we should leave seniors alone.
In the past, Oregon was recognized leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivery that once provided maximum independence and dignity and choice among our vulnerable populations. With this in mind, please give us a 2-minute overview of what your political agenda and interests as they relate to seniors and people with disabilities, and how can we restore Oregon's leadership in this area?
Well, first off, I don't think it's a Democrat or Republican issue. I think it's a moral and ethical issue. And I think, and I always go back to money because that's what we're looking at here. In the different care homes, for instance, seniors' homes are paid the least. And then it goes up to mental health and then developmentally disabled all the way up. What I don't understand is that, and part of my agenda would be to fight for the seniors because they're the ones that have been in the tax-based system for years. They're the ones that raise their children in Oregon, and we deserve better than that. And so there again, with everything needs to be brought up to standard. You know, how scary is it, number one, to think of your care as being only paying $1,200 to $2,100, number one. What kind of care are you going to get for that? It's not good. In fact, if you have to have a staff person, that $2,100 does not even cover wages at minimum wage right now. So we have to restore and we have to increase. The fact that seniors in these homes are the ones that have built this state. we need to reprioritize where this money is going. And as far as, they should have a right to live at home if that's what they want to do. And one of the scariest things to me is, number one, how we fund it, as far as what kind of care you're going to get for $1,200. The second one is we as Oregonians not having a choice of what's going to happen to us. And so I think there needs to be a broader, and it really needs to be looked into, as far as seniors' voices need to be heard. Developmentally disabled people, their voices are heard. Mental health people, their voices are heard. Seniors, I'm not so sure all the time. And I say this from personal experience in running a senior home and actually visiting with the people that are in it.
Federal budget cuts through sequestration are having a significant impact on the ability of the area agencies on aging to maintain critical services such as Meals on Wheels, in-home care, which helps seniors remain in their own homes. Would you support using state general fund money to restore senior program service levels diminished due to federal sequestration?
Absolutely, and I'll tell you why. First off, Meals on Wheels. If we don't have a program like that, I don't know how many people I've met over the years that if they didn't have Meals on Wheels, they wouldn't be eating. And so I don't care where the money comes from, it needs to be restored, and it needs to be looked at, and it needs to be increased. Look, part of the American dream is working hard and getting ahead. Well, once you do, you shouldn't be forgotten about because you've paid your taxes and you've moved on. These are the people we need to take care of more than any. And you know, there again, if I have a resident in my developmentally disabled home that wants to go to Portland for a doctor, and we've got 4 doctors there that can do it in town, at a cost of $313 to take a medics from where I live to Portland, we could use those dollars a lot better. And Meals on Wheels, things like that not only need to be looked at and restored, we need to look at broadening those. And as far as in-home care, if we don't have in-home care, if we're cutting in-home care, I'm kind of nervous about what the rest of the budget looks like, because in what I've seen in running for office, there are a lot of areas we can cut and that needs to be cut. Right now we have 180 state agencies. I'm sure we can find money to double what we're doing right now.
If elected, what can seniors and adults with physical disabilities expect from you?
Well, the first thing is an open door. In any issue that I would help decide as a state representative, I would look forward to having a discussion with seniors in senior groups before any decision's made, before people that are for it, people that are against it, and then come to a conclusion that's best for our district and what's best for our state. And right now, I got to be honest, I'm not finding that that's what's happening with seniors. Everybody else has a voice. There again, everyone else has a voice, and seniors have a voice, and their voice ought to be heard stronger, if not strongest, out of all of them.
Thank you, Mr. Rose, Republican candidate for House District 32.
Thank you, and it's been a privilege to be asked to be here.
Thank you.
Thank you.
I'm Phyllis Rand from Northwest Senior and Disability Services Advisory Council. I'm interviewing Ken Moore, who is the Democratic candidate running for House District number 24. Mr. Moore, tell us at least 3 of your positions that would make a senior or an adult with physical disabilities encouraged to vote for you.
Well, thank you, Phyllis. That's a great question. I have thought about that, and the first thing I want to mention is my passion for looking for and finding common ground. The divisiveness that we find in our government just isn't working for us. When we're working together to solve a problem, I find that if people will listen not just to what is being said, but why they are saying it, that often a common vision will appear and you can work from common ground. Well, the second thing is that I've been talking to a lot of people on doorsteps, and from seniors, I've been hearing that they're paying too much. I'm committed to an Oregon economy that works for everyone. And I will work to recreate the opportunities for middle income and low income families. And the third thing is that I am concerned about the growing power of special interest groups that work for the benefit of profit over people. I will bring my passion for transparency and accountability in government to Salem. And I want to summarize those three things by saying the phrase that we all know: of the people, by the people, and for the people.
Regardless of the state revenue forecasts, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with physical disabilities?
Well, Phyllis, it makes sense that needs that are funded by matched federal dollars should be prioritized. We need to stretch our state dollars. We need to look at the populations that have repeatedly sacrificed. And I think they have sacrificed because either they did not have a voice or that voice was not heard. So we need to look for and listen to those populations. I'm aware that two of these populations are seniors and people with disabilities.
Thank you. In the past, Oregon was a recognized leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivery that once provided for maximum independence, dignity, and choice among vulnerable populations. With this in mind, please give us a 2-minute overview of what your political agenda and interests as they relate to seniors and people with and adults with physical disabilities, and how we can restore Oregon's leadership in this area.
Well, Phyllis, we can restore Oregon's leadership in home care and community-based care by restoring its economy. And this requires focusing on and expanding our industrial sector. A good economy means folks are working and paying taxes that can support our most vulnerable populations. The second thing is, to grow our economy, we need a healthy education system that provides graduates that can work smart and work hard so that businesses can succeed. That's why my political agenda is simple. It's very simple: jobs and education. Now, many of the programs that provided for independence for seniors, they actually saved the state money while providing dignity and choice for the seniors. So it makes sense to restore those programs and save that money and provide the seniors with the options and the freedom and the dignity that they had before. I will support the patient-centered coordinated care organizations that have been working very well. They allow for preventative services, chronic condition management, and have a single point of contact for behavioral and physical and other types of care. They have reduced cost, they've raised the level of care, and they have moved decisions and control back to the patients and their doctors.
Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services such as Meals on Wheels, in-home care, which help seniors remain in their own homes. Would you support using state general fund money to restore senior program levels diminished due to the federal sequestration?
The needs like that Meals on Wheels and in-home care and medical transport that they met are still there. Oregon can't fix the federal government's problems, but we can certainly look toward taking care of our own. When I moved to Oregon, I cleared some trees on my land and I used those trees to build my house. And when I did that, I had lots of advice and help from my neighbors. And I want to return to that place where we as a community can help each other to maintain our independence.
Mm-hmm. If elected, what can seniors and adults with physical disabilities expect from you?
I like that question. My campaign is focused on hearing the needs of voters, and my time in Salem will be spent making sure that they know that their voices are heard. In addition to having an open door policy, I will actively reach out to members of the senior and disability community when I see legislation that could potentially impact them. I'm a small business owner, an engineer, I'm a problem solver, I like to work hard. We can build a community where there is a rich opportunity for education and business, where children are eager and ready to come to school to learn, where families and businesses thrive, and where the government enacts the will of the people with transparency.
Thank you, Mr. Moore. Democratic candidate for House District number 24.
I'm Ruth McEwen from Northwest Senior and Disability Services Advisory Councils, and I'm interviewing Betty Comp, who is the Democratic incumbent candidate running for House District 22. Representative Comp, tell us at least 3 of your positions that would make a senior or an adult with physical disabilities encouraged to vote for you.
Thank you, Ruth. I have continuously supported seniors and Oregonians with disabilities and dedicated to furthering their interests. I have worked on the full Ways and Means Committee to increase funding for the Oregon Project Independence, which is an initiative that services to protect to our seniors and adults with physical disabilities in the community so that they can stay in their homes. It is one of my top priorities to ensure that staying in their homes, living with dignity is the thing that happens. This helps forego a lot of financial stress and nursing home care. They can get their care in their homes, whether it's in hospice care or other things. In addition to supporting independent housing, I have also focused on helping those within assisted living facilities to receive the care that they deserve. We have found that there are times where we are paying for a certain level of care and that just has not been happening, and the person's health does have serious negative impacts. The last part of that issue, the third issue, is that we want to make sure that there's no mistreatment, whether it's in your own home, a nursing care facility, or a hospice care. We need to stand up for vulnerable citizens and make priorities to make sure that there's, beyond their physical care, there's no unfair tax burdens and mistreatment by insurance companies. Heaven forbids we have plenty of things to help monitor to ensure that people aren't taken advantage of. Thanks, Ruth.
Regardless of the state revenue forecast, How will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with physical disabilities?
Well, it does seem to be a little bit of a cat and mouse game. People really do understand that many of the funding tracks come from the federal government, but Oregon Project Independence is the key piece of legislation and funding. Last session, we put additional funding into Oregon Project Independence, saying yes, we believe in having people stay in their homes, and it isn't always just having that matching funds that creates the best environment. So we are going to continue. I now also serve on the emergency board, and we'll have a major meeting coming up here in December to make sure that those funding streams are still adequate.
Thank you. In the past, Oregon was recognized leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivery that once provided for maximum independence, dignity, choice among our vulnerable populations. With this in mind, please give us a 2-minute overview of what you did in the past legislative session to enhance services for seniors and adults with physical disabilities.
What we've done in the past several sessions is we are looking at foreclosure laws. I was just asked this morning by a constituent, what can I do? My bank has sent me all the paperwork, said I can't live here anymore. And so we are providing those types of protections, particularly people with disabilities and vulnerable citizens. The 2012 session was our key session on looking at that. What we did was to make sure that there was somebody in between insurance companies, banks, and the constituent, so that we had all the parties in the room, so we had all the pieces, so that there was an opportunity to really make a coordinated decision as what you could and could not do. Also talked to a person yesterday that shared after they did the foreclosure with, I have to think of the name of it. It's, I know, Ruth, you can't help me, but it's where you take the equity out of your home. And after they went through the whole process with their banker told them after they paid all the back dues on their property taxes, I guess we have $600 left to give you. And that's reverse mortgages. And it's like, I did all this, and now I'm supposed to live on $600, or where am I supposed to live? These are people in crisis, and we still need to be doing monitoring and doing a much better job of following up to make sure that this mediation is working.
Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services such as Meals on Wheels and in-home care, which help seniors remain in their own home. Do you support using state general fund money to restore seniors program service levels diminished due to federal sequestration?
Absolutely. The federal sequestration, as we all know, followed up on the pieces that, there were cuts made during the recession. We did not have any choice but to cut $3 billion from our budget. And we all suffered it for it, human services, schools, everybody. Now with sequestration, it was also a program. My neighbor just was moved into a care facility. She had in-home care. She had Meals on Wheels, and yet there are times where you still have to face that decision that your family, your children can't always be there to take care of you if you end up in the emergency room and those sorts of things. And so we absolutely have a responsibility as members of the Budget Committee, Emergency Board, to take these concerns and say, we have to do better. It's going to be a tough session for balancing our budget once again, because there's always the tug of what if money goes to health care, if it goes to schools. And I think the best thing that we could do is make sure that we're not incarcerating people that need mental health, and that those things need to be taken care of before we make final decisions.
If reelected, what can seniors and adults with physical disabilities expect from you?
Well, Ruth, I'm here. This is my 5th time, I think, and part of that, this year I kind of came to the realization that I just turned 65. These issues are becoming more real and more real to me, and that is why I am going to continue being a strong advocate, ask the tough questions, and make sure that we're protecting and helping. And I think the most important thing for all of us, we've particularly some of us that have lived longer lives, good lives, that we've earned the dignity. We deserve to have the treatment that lets us continue to give back to our communities, give back to each other, and that's my promise. I think we have so many people, and particularly retired people now, that are looking for ways to give back. And if that's helping somebody with hospice care, and I was fortunate when my children were growing up, I used to do hospice care for patients that were dying with cancer, and it's always in my mind of what those needs look like and how we need to take care of each other.
Thank you, Representative Kump, Democratic incumbent candidate for House District Number 22.
I'm Gussie Brown from Northwest Senior and Disability Services Advisory Council. I'm interviewing Beverly Wright, who is the Republican candidate running for House District 21. Ms. Wright, tell us at least 3 of your positions that would make you a senior or adult with physical disabilities encouraged to vote for you.
Well,
1.5 minute response.
1.5. Well, for me, it comes down to, I understand the programs from the inside out. I actually am disabled. I broke my neck 15 years ago. I know what it is to be a quadriplegic, have brain surgery, the likes. Because of these accidents in my life, I've actually lived the program. I understand how little there is on the food stamp card. I understand the blocks that come up with the medical care. I understand what it's like to deal with good workers in the state capitol and the laws that interfere with a healthy life. I understand what blocks the programs, and that we simply need more funding. So there needs to be more direction in how we're going to achieve getting the funds where it needs to be with the people, because it really comes down to funding. It's not that the workers don't want to care for the people who are there, they do, but they need the tools to do the job, and that's where I want to step in.
Okay. Regardless of the state revenue forecast, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with physical disabilities?
I actually have a plan for that. When I read over the wonderful paperwork, it's called the 3B supportive, they stipulate in here that 13% actually goes to running the programs themselves, which was great. Okay, that's reasonable. But then I looked further and I found that they have a section about pharmaceuticals, about drug dispensing and the like. That's 25.9% of the funding that they're taking to go in. They're putting more money into the prescriptions of the people, which makes absolutely no sense to me. But at the same time, I look over here and it's 3%. 3% of the entire budget, matched with the federal government or not, is being placed into actually caring for the people. Frankly, I look at it this way, that 25.9% that has been going into pharmaceuticals, which is actually dealt by the care providers, the doctors, or the family or the person themselves, it's ridiculous that that money's going there. That should be a 3%. The 25.9%, that's where the money needs to come from. That's the tools that we need to actually utilize and care for the people here in Oregon.
New candidates in the past, Oregon was a recognized leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivered that once provided maximal independence, dignity, and choice among our vulnerable population. With this in mind, please give us a 2-minute overview of what your political agenda and interests as they relate to seniors and adults with physical disabilities and how we can restore Oregon's leadership in this area.
Well, here's what I think should happen. Now, mind you, my mother is in what they call a memory care facility. It's not a nursing home, but it's $6,000 a month my mother has to pay through these programs for half a room. Half a room! And that's ridiculous, and she's been abused there. But you see, when senior disability goes over to protect the elderly in these memory care facilities, they can't do anything about the abuses that are happening in them. These businesses are businesses. They're not actual nursing homes. They're not homes for people with physical disabilities that need care. They're actually set up as an apartment complex, nothing else. So when there are problems, the Attorney General's office cannot pursue them in a way that will stop the abuses that are happening. It also binds the hands. So we're getting an increase of abuse, and we're paying $6,000 for half a room, whereas a care provider actually is paid $2,000 a month. And there's a process that many people are being withheld from having services by saying the adults, if they are married, elderly married couple, one adult has to do it or they get no services. I think that's ridiculous. I think if a husband and wife are very aging and one of them needs quite a bit of care, instead of paying $6,000 to set one person into this one seat, a half bedroom, pay $2,000, care for both of the adults, and for the same $6,000 my mother is spending, we could get 6 adults in 3 homes with 3 care providers for the same cost. We could increase taking care of more people. Married couples need care too. And when you are an aging husband with an aging wife who has dementia or Alzheimer's, you need the support services there in the home. And telling them, I'm sorry you're married, put her in an expensive care facility, that's silly. Keep them independent, keep them in their home, and keep them out of these centers that are businesses. They're not medical services. And if those places are going to be open, I personally want to see laws enacted that make them accountable on the same level that every doctor, every care facility for people with physical handicaps, every nursing home, they need to be held to the same level of care. And there needs to be an ability to actually prosecute it, you know, when they do things that are inappropriate. Because there is a lot that's going on out there, and I want to see more care happen. And the funding is there. It's just a matter of making sure we deal with it.
Okay. Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services such as Meal on Wheels and in-home care, which help seniors remain in their own homes. Would you support using state general fund money to restore senior programs, services level diminished due to federal sequestration? 1 minute to respond, please.
I absolutely would support it, and I frankly think that the general fund is a scoundrelly thing because they don't have to account for that money in the general fund. That used to be petty cash. There is money there. If there's money enough to build bridges over in Portland and pay off companies, because their ships can't come underneath, for programs that we don't want that go under, that the governor has done. If there is money enough to waste on Obamacare, which is a travesty and is causing so many problems in this line has got to be taken care of. If we can't stop the waste, then we can't help the people. And as far as I'm concerned, when you pay your taxes, you are making the state of Oregon your payee. Those are your dollars going to them. If they're not paying the bills first, they have no right to any projects on the side. So there is money there, and I would pursue it. Hardcore, I would pursue it. I don't go along to get along. I won't do it.
If elected, what can seniors and adults with physical disabilities expect from you?
They can expect that I will hear them, I will acknowledge what they're saying, and I won't say they're crazy or push them off to the side. I actually have referred people over to the ombudsman up at the governor's level for people who are elderly. That woman wouldn't even talk on the phone. She sat and gave me dead air, and the gentleman I sent to her, dead air. That's not helping anything, and I'm sorry, there needs some accountability, and it's one thing to say you have these programs which will allow people access. Well, it's no access if you call the number and the person's not willing to speak to you, that they don't believe that there's a problem, that you have a family member being hurt, or you're not getting care or access to programs. That has to occur. And I, for one, having lived it, I know you're not telling me stories, and I won't disrespect you because you have a wheelchair. That won't happen.
Thank you, Ms. Wright. Republican candidate running for House District 21. Thanks.
Hi, I'm Chuck Richards from Northwest Seniors and Disability Services Advisory Council. I'm interviewing Bill Dalton, who is the Democratic candidate running for House District number 19. Mr. Dalton, tell us at least 3 of your positions that would make seniors or adults with physical disabilities encouraged to vote for you.
I think in terms of positions, it may not be as important as background. In terms of the career, basically lifelong, that I've spent working with people with disabilities, seniors, developmentally disabled, those with mental and emotional disturbance. In terms of positions with respect to legislative, I think an important issue for us to be taking a look at this coming session and the next couple of sessions basically is long overdue. And that's the whole issue of tax reform. It's very difficult for us to implement the kinds of services that are needed by our seniors and disabled folks in the community with the kind of budget that we've been dealing with over the past decade and a half. We've got too little revenue. It's an antiquated system. It's a two-legged stool. And we really need to take a look at what we can do to address those kind of underlying issues. Certainly in terms of the specifics, we want to continue our efforts to request waivers from the federal government to allow us to use federal funds from the Older Americans Act in ways that are most responsive to the needs that we have here in Oregon. And we also need to push forward on the very excellent and positive goals that have been established for health care reform in the state.
Regardless of the state revenue forecast, how will you prioritize state funding, including funding that is matched with federal funds for services of seniors and adults with physical disabilities?
Having worked in local government for a good chunk of my life, including for private nonprofits in the community, I always feel that one of the most important things that we need to do is to look for leverage. Leverage in terms of utilizing state funds and local funds to access the maximum of federal funds available to us. And another way of, I think, looking at maximizing our resources is to look at the partnerships that can be built between the state, local government, and our very important private nonprofit community.
In the past, Oregon has recognized leadership in the providing of home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, the recent circumstances have diminished Oregon's reputation for innovative services and deliverance that once provided for maximum independence, dignity, and choice among vulnerable populations. With this in mind, please give us 2 minutes of overview of the political agenda and interests that relate to seniors and adults with physical disabilities, and how you can restore Oregon's leadership in this area.
I'm pleased to say that as I've talked to voters and basically affirms my own experience, I think people recognize the importance of the so-called safety net here in Oregon. I think the struggles we've had on the state level in terms of trying to work out our budget quandary have happily always involved the need and recognition of the need for not only establishing the safety net, but in trying to adequately fund it. This effort absolutely needs to continue, but can only be successful in the long run if we do take a look at bipartisan tax reform. That said, we need to make sure that we provide at least enough in the way of funding to maintain our basic services and look at creative ways of building and utilizing partnerships in the community.
Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services, such as Meals on Wheels and in-home care, which helps seniors maintain in their own homes. Would you support using state general fund money to restore senior service levels diminished due to federal sequestration?
I think the answer is obvious and yet at the same time very difficult. Yes, I would definitely support at least a temporary tapping into state general funds to assure that these essential services continue. In the long run, however, I think we need to do several things. Among them, we need to take action at the local level to put pressure on the politicians in Washington, D.C. to get beyond the sequestration and develop and act on budgets that will provide meaningful funding at the state level and then, of course, at the local level. I think it's also essential that we take a look at the commitment that we have in terms of trying to save money ultimately in the state by providing the kind of services that are available through Northwest Senior and Disability Services. We're talking about leverage here, we're talking about early intervention, we're talking about prevention.
If elected, what can seniors and adults with physical disabilities expect from you?
Well, I think the first thing they can expect is basically a continuation of what my personal and professional life has reflected for a number of decades. I won't mention how many. And that is advocacy and definitive support that comes out of a belief system that recognizes the importance of maintaining the independence of seniors. The aging in place concept is one that I saw with my own parents. My mom lived till she was 89, my dad until he was 99. And I saw the ability of the service community here in Oregon to provide them a quality of life right up until they passed on, and I'm completely committed to that. I think the other thing that's terribly important is accessibility. You don't want your elected representatives going to the Capitol and then just operating within that context as they make the decisions that are essential to the operation of a program like this.
Thank you, Mr. Dalton, Democratic candidate for House District number 19.
I'm Phyllis Rand from Northwest Senior and Disability Services Advisory Council, and I'm interviewing Paul Evans, who is a Democratic candidate running for House District 20. Mr. Evans, tell us at least 3 of your positions that would make a senior or adult with physical disabilities encouraged to vote for you?
Well, first of all, thank you very much for the opportunity to take part in this conversation. Three things I think that folks would be interested in supporting me because of have to do with, number one, the fact that I have experience in political office as a mayor, a school board member, a former senior policy advisor for Governor Kulongoski on veterans and emergency management issues, as a teacher, and also as a veteran with 20 years in the military. I think that I can offer voters a level of experience and background that is unique in this particular race. In terms of the significant issues, first, I am focusing on trying to take care of veterans and veteran services. A number of seniors are either veterans themselves or related to veterans. That's something that I take pride in being a leader in. The second thing is working on our economy and trying to emphasize small business development, trying to make sure that folks in Oregon have an opportunity to compete. Sometimes it's hard for us to recognize that right now in America, individuals and small businesses don't have a lot of the same opportunities as big corporations, and quite frankly, seniors, a lot of seniors are working longer than they should have to, but if they're going to be in the workplace, they should have more opportunities to succeed. I also believe that minimum wage is a major issue. Minimum wage is one of those issues that it's not going to fix the economy, but for folks that are on fixed incomes and trying to have a little bit of help around the edges, minimum wage can provide the difference between getting that last medication or not. So those are three things that I think matter this campaign.
Regardless of the state revenue forecast, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with physical disabilities?
I think that the question about how we prioritize funding for seniors and disability services in a budget-challenged environment really goes back to the basics of understanding how government works. First, anytime you can leverage federal funds for greater long-term impact, that's a force multiplier. So I tend to prioritize those pretty much ahead of everything else, as long as those federal goals are aligned with our goals, which in these particular issues they are. The second thing you can do is you can also look at current expenditures, current outlays for tax credits, current outlays for incentives for businesses and for nonprofits, and align those for the kinds of service outcomes we would like. And I hope to be a leader on those issues if given the opportunity to serve.
Oregon was recognized as a leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivery that once provided maximum independence, dignity, and choice among our vulnerable populations. With this in mind, please give us a 2-minute overview of what your political agenda and interests are as they're related to seniors and adults with physical disabilities, and how can we restore Oregon's leadership in this area?
I think that's a great question. In terms of, if given the opportunity to serve, what I plan to do in public policies related to seniors and folks with disabilities. In many ways, my priority on small business development and economic growth, on education, workforce preparedness, and on veterans reintegration and veterans care will help everybody across the spectrum. But in particular, the emphasis to those that especially are at risk among the population of seniors and to those with disabilities that have special needs. We have to pay particular care to recognizing the things that work and in some cases changing bureaucratic models when things are not working. And that goes back to the difference between experience and non-experience. It's very easy for people sometimes in the cheap seats to talk about what they would do or what they could do. It's very different when you're actually in the arena trying to make good compromise happen. I have experience doing that as a former mayor. We were able to bring people together to do certain types of things. We generally didn't make anybody 100% happy, but we made most people about 80 to 85% happy. In terms of this particular effort, We have to recognize that seniors living on their own in a safe environment is a priority, which means we have to look at transportation systems, we have to look at healthcare systems, we have to make sure that it is easier for folks to live independently in a safe way. Second, if it's not possible for folks to live independently in a safe way, we have to find systems and structures that play to the local creativity and innovation of a community to allow people to enjoy as much of life as they can, as long as they can, in a dignified manner. Those are priorities for me. They go back many years to when my own family had some issues with a grandmother who had a stroke and had to learn how not to live independently. I applaud Project Independence and the progress that's been made over the past years, and if given the opportunity, I plan to work very hard to bring people together to find the tools necessary from the state to provide locals the options to be able to provide innovative, creative solutions for the seniors and folks with disabilities in their own areas.
The federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services such as Meals on Wheels, in-home care, which help seniors remain in their own homes. Would you support using state general fund money to restore senior program service levels diminished due to federal sequestration?
Yes, I would. I would absolutely work to try to find ways to leverage general fund dollars to fill in the gaps and the holes left by sequestration and other federal budget measures. That said, I think the larger problem is that we have to get used to a new environment where seniors are living longer, where the costs associated with health care and long-term care for those with disabilities are going to become larger, and the federal government's ability to do some of the things it used to do is probably going to decline, because with $17 trillion in debt, there's only so much that the feds can do. What that means, it doesn't mean that we don't have the responsibility as leaders to find solutions. It just means we've got to be more creative. We've got to come up with different types of systems that work in Oregon, perhaps going for waivers from federal programs in order to do it. We've got to look at our tax system and make sure that local governments, especially in private, nonprofit, and public partnerships, have more flexibility. And we've got to rethink how people move around, how people are cared for, and find ways to make sure that those that are living on a fixed income have more tools at their disposal to have the better quality of life that they deserve. If given the opportunity, I believe I can help make a difference. It goes back to the difference between having a lifetime of experience, proven leadership, and a belief that public service itself is a valuable effort. And the government is never the problem, the government is never the solution. It's a facilitator to help creative, innovative solutions come to light.
If elected, what can seniors and adults with physical disabilities expect from you?
If given the opportunity to serve as a state representative in House District 20, seniors and those with disabilities and everybody else can expect really only three things. Number one, I will work harder than any other person in the legislature for this district, and I will work harder to try to build an Oregon that we know is possible. Number two, I'm going to tell you what I think. I will listen, I will learn, I will always be the honest broker. Sometimes that's going to make you mad, but most of the time I think it's going to help everybody understand where we're at and what we can get done. And the third, and I think this is the most important part, if you elect Paul Evans, you're electing somebody who can start on day one. I've spent a lifetime in and out of uniform, I've spent a lifetime in public service, and I believe that having the skills to be able to navigate the labyrinth of federal and state and local government is essential. When I was Governor Kulingoski's senior policy advisor, I also was given the opportunity to be the chair of his task force on veteran services. We brought together 27 people on a task force that represented diverse ideological opinions, diverse age cohorts, diverse experiences. We put together a package of 24 pieces of legislation that passed in the 2009 session. I point to that as evidence that if given the opportunity to work at the state level, I can help bring people together, span the differences, and move Oregon forward. That's what I hope you can expect, and if you give me the opportunity, I would be I would work very hard to make sure that I live up to that promise.
Thank you, Mr. Evans, Democratic candidate for House District 20.
Thank you.
I'm Cheryl Statz from Northwest Senior and Disability Services Advisory Council, and I'm interviewing Wanda Davis, who is Democratic candidate running for House District 23. Tell us at least 3 of your positions that would make a senior or an adult with physical disabilities encouraged to vote for you.
I'd be pleased to. One of my first most important positions is on public safety. In Polk County, you may be aware, we've had some problems with the funding. We're not getting the timber funding that we used to. And our Sheriff's Department has cut a lot of, well, they're down to patrolling 10 hours a day. And so anything that happens outside those 10 hours, we don't get a sheriff's response. So we have folks out in the county who aren't able to get any assistance at all hours of the time, of the day. So I think probably, especially, you know, it being a rural district, and especially in Polk County, it would be important to seniors and people with disabilities who might be living in those rural areas to be able to have that response should they need it and whenever they need it. Also, I think something that would make a difference is veterans issues. Now, I am a veteran. I'm also a former military dependent, so I understand those issues. And it's my understanding, of course, a lot of seniors have served, and the VA can't do it all. So I think that the services that you all provide are real important to those folks too, as well as the younger veterans coming back with their physical and other disabilities. So I think that's also going to be a good reason for seniors and people with disabilities to vote for me. I also would like to do full employment, get this coming back into our district. More people employed means a broader tax base, and we can have the money to fund the services that are so important to folks who are older and may have disabilities.
Okay. Regardless of state revenue forecasts, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with physical disabilities?
Well, I'd like to at least keep our current funding levels and try to increase those. And again, if we can get people back to work, we'll have the tax base we need to do that funding. And I really, I'm frustrated when we get into seeing our priorities being either or, and we're pitting priorities, all of which are very important, against each other. I just don't like that. I don't think it's a good way to do it. Everything we do as a society is tied to the next thing. So if we're cutting something somewhere else, it's like hydraulics. If you squeeze it over here, it's going to pop out over there, right? Yeah. So I think we need to find a way to make sure we have the revenue to make sure these things are funded. And frankly, I think that the best way is to make sure we've got full employment, living wage jobs.
Okay. In the past, Oregon was a recognized leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivery that once provided for maximum independence, dignity, and choice among our vulnerable populations. With this in mind, please give us a 2-minute overview of what your political agenda and interests as they relate to seniors and adults with physical disabilities, and how we can restore Oregon's leadership in this area.
Well, again, as I said, everything is connected to everything else. And so what we really need to do is get those jobs, get them going. We need to, I just visited, yesterday I visited, or rather Thursday, I visited with Sequential Pacific Biodiesel plant here in Salem. And out there, they're taking what used to be waste products, cooking oil, and turning it into biodiesel. And they are creating living wage jobs, which means all of those folks have good wages, they have good benefits, they can support their families, but they're also contributing to the tax revenue. That's what we we really need to do, I think. We need to also look farther out than the current biennium. It seems like we are always looking right in front of us rather than down the road. And this is something I relate back to high school. I took driver's ed in high school, and that's what they taught us, was don't look right in front of the car because you'll always be adjusting this way. And that's how I feel like our government is doing. They taught us to look far down the road so you can see a car coming in from the side, and you can adjust for that if you need to. And so that's where I think we really need to take the long view, look 10, 20 years out, and make sure that we're adjusting and we're ready ahead of time. One of the things that I think frustrates me is that we have these boom and bust cycles. We have jobs, fewer jobs, people are laid off, and we cut services, and of course that's counter-cyclical to the boom times when we've got the money, and then we go, oh yay, we're going to refund all these programs, but we don't look ahead and fund that rainy day program or rainy day fund so that we have the resources available in the bust times. So that's what I think we really need to do is look ahead.
Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services such as Meals on Wheels and in-home care, which helps seniors remain in their own homes. Would you support using state general fund money to restore senior program services levels diminished due to federal sequestration?
Yes, I think I would support that. However, as I said before, our current system makes competitors of needed programs. And budgets are moral documents. They show our priorities. And I don't think we can afford to let any citizen languish for lack of funding. It hurts us all. We have to look at everything as coming back to the individual. Now, I know some folks will say, well, it's personal responsibility and it's, we need to take care of ourselves. But by taking care of everyone, we are taking care of ourselves. That's one of the things that I always have said, that I don't have kids in school anymore. Why should I have to pay taxes to do education, But the fact of the matter is, when I'm older, when I may need these services, I want well-educated citizens taking care of me. So funding schools at a decent level, it's selfish, it's for me, even if I don't have kids in school. So that's the way I look at this. We need to really look at it as how it affects each of us individually, and that if it affects someone negatively, it's affecting us all negatively.
Okay. So if elected, what can seniors and adults with physical disabilities expect from you?
Well, I want to make sure that they know that they have the same access to me as any other constituent. And when we're looking at making decisions about funding and programs for seniors and people with disabilities, that we talk to the agencies and the people themselves to find out how is this going to affect you. So I really want to keep people involved in the whole process. So that, I guess, would be what I would say about that.
Well, thank you, Ms. Davis, Democratic candidate for House District 23.
I'm Ruth McEwen from Northwest Senior and Disability Services Advisory Council, and I'm interviewing Patty Milne, who is a Republican candidate for Senate District number 11. Patty, would you tell us at least 3 of your positions that would make a senior or an adult with physical disabilities encouraged to vote for you?
Thank you, Ruth. I'm going to start with my experience with Northwest Senior and Disability Services background, which goes back to the 1990s when I was a state representative and supported the agency and the program's services and budgets back then. Through then my 15 plus years as a county commissioner, I served on the Northwest Senior and Disability Services Board of Directors. I chaired the the board a few times in there. And I volunteered to be the designated commissioner to serve on this board because of my very strong and deep-rooted belief that it is our responsibility to protect the most vulnerable among us. And of course, that means our duty to our seniors and our adults with disabilities. And through this public service, I have fought for funding at both the state and the federal level. I've fought to keep the programs and the services adequate and meeting the needs of our seniors. And of course that includes the whole array of whether it's the meals, the transportation, even legal services, and all addressing the quality of life and the respect for the dignity of these individuals. So with that background, those are the reasons why people would support my candidacy.
Thank you. Regardless of the state revenue forecast, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and people with physical disabilities?
The budgets for seniors and adults with physical disabilities, along with our education budgets statewide, should have, in my opinion, public hearings, be totally vetted and completely voted on, passed, and even signed by the governor prior to any other budget hearings and actions on other budgets. And I say this because I believe it's so important that these very decisive first budget actions are completed, because these budgets do affect our most vulnerable citizens. And very often in the legislative process, the individuals, the very lives of these individuals end up being the bargaining chips for other behind closed door budget negotiations. And we're talking about people's lives, and it is just not appropriate at all that people's very lives and their well-being, their dignity, and their quality of life would be affected this way. So get these budgets out of the way as a first priority, and that's where we ought to put our attention in that process. It really troubles me deeply. We're talking about people who could be our parents, our aunts, uncles, our friends, and our neighbors, and we're ignoring their very lives when the budget for their well-being is a bargaining chip.
In the past, Oregon has been a recognized leader in providing home and community-based care for seniors and adults with physical disabilities versus more expensive nursing home care. Unfortunately, recent circumstances has diminished Oregon's reputation for innovative service delivery that once provided for maximum independence, dignity, and choice among our vulnerable populations. With this in mind, please give us a 2-minute overview of what your political agenda and interests as they relate to seniors and adults with physical disabilities, and how we can restore Oregon's leadership.
It's heartbreaking to me that proven programs that put seniors, and of course adults with disabilities, put their best interests we should be putting these first. And programs, of course, like Oregon Project Independence have virtually been on the chopping block. They've been subject to, as I just mentioned a moment ago, to other budget negotiations or even special interest agendas that aren't related to budgets. And we're talking about people's lives, and we're talking about programs that are proven to raise the quality of life and protect the interests of these individuals. So I find it just unconscionable that our seniors, and of course the folks with disabilities, their lives are constantly threatened. The fear of being displaced from their home, and where would they go to live, and what services might be available. This dramatically affects the life they live, their happiness, their well-being, and productivity, simply their enjoyment. And again, these are real people. These are family members. These are neighbors. These could be us. And not knowing what the future is really, to me, is very embarrassing that we find ourselves in this position with regard to budgets and stability of programs. And I think it's disrespectful of these individuals that we should put these budgets, these programs, and their interests as our priority. And of course, again, these programs have over and over again proven to be cost effective if you're looking at budgets and in the best interest of these individuals.
Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical service such as Meals on Wheels and in-home care, which help seniors remain in their home. Would you support using state funds to restore senior programs service levels diminish due to federal sequestration?
Yes, Ruth, and yes, listeners, I would support using state general fund money to, specific to the question, yes, to restore the service levels due to these diminishing federal funds. Again, if people are our priority, as the saying goes, then let's put our money where our mouth is. And we owe it to them, they've earned it, to keep these individuals safe and healthy and in the best environment for their well-being. It's sad that we are at a place of these diminishing dollars and the problems of funding at the federal level. If the burden is put on the state, and it's too bad that that's where we find ourselves, and I would advocate very strongly that we relentlessly lobby our congressional delegation so that we can get the proper and appropriate funding from the federal government. If that's not there, then yes, we as a state have a responsibility to step up.
If elected, what can seniors and adults with physical disabilities expect from you?
My commitment to seniors and adults with physical disabilities goes back, as I mentioned earlier, to when I first became a public servant as a state representative back in the 1990s. When I first became acquainted with area agencies on aging. Back when this agency right here was just Marion, Polk, and Yamhill counties, and being able to serve on this board and watching the changes and the growth and the commitment of everyone involved, the staff, and remembering people who came before who are no longer with us, and many volunteers such as yourself, Ruth, the commitment and the hard work and the struggles to keep these programs alive. This is a top priority. Again, these people we serve through this agency and our personal commitment to our neighbors, our friends, our family, and to fellow citizens. This is a priority for me. It always has been, and it will continue to be.
Thank you.
Thanks.
This is Ms. Milne, Republican candidate for Senate District number 11.
I'm Carol Hankins from Northwest Senior and Disability Services Advisory Council, and I'm interviewing Scott Mills, who is a Democratic candidate running for House District 18. Mr. Mills, please tell us at least 3 of your positions that you would make a senior or an adult with physical disabilities encouraged to vote for you.
Well, I've been out on the campaign, And I've been meeting with people at the door and have seen a lot of the issues you're talking about. People are really struggling in their homes and they need some assistance. Would really like to see some of the programs that keep seniors in their homes expanded. It's good for them and it's good for the communities that they stay there, because most of them are community activists at some level and have supported the community and know a lot about it, and would like to see those programs expanded so that people have a higher quality of life for their retirement.
Thank you. So, regardless of the state revenue forecast, how will you prioritize state funding, including funding that is matched with federal funds for services for seniors and adults with physical disabilities?
Well, I believe that we're going to have to start expanding programs that include seniors at a better level for funding. That population is growing every day, and we need to really maintain a quality life for those people, so that they can live out the quality retirement that was promised to them.
Okay, thank you.
Okay.
So in the past, Oregon was a recognized leader in providing home and community-based care for seniors and adults with people with disabilities versus more expensive nursing home facility care. Unfortunately, recent circumstances have diminished Oregon's reputation for innovative service delivery that once provided for maximum independence, dignity, and choice among our vulnerable populations. With this in mind, please give us a 2-minute overview of what your political agenda and interests as they relate to seniors and adults with physical disabilities, and how we can restore Oregon's leadership in this area.
Well, we've seen in the past couple of decades a trend to let people fend for themselves. And we're discovering that that's not working. As people age, they become more vulnerable in communities, and they need to be protected. As far as fraud, people that are senior have a more susceptible lifestyle that makes them targets for people who want to take advantage of them. I want to see the fines and criminal charges for that behavior expanded. We should not allow our seniors in our communities to become victims just because they are unable to cope with the sophisticated people that are trying to take their assets. And that is a very important issue to me.
Federal budget cuts through sequestration are having a significant impact on the ability of area agencies on aging to maintain critical services such as Meals on Wheels and in-home care, which helps seniors remain in their own homes. Would you support using state general fund money to restore senior program service levels diminished due to federal sequestration?
I believe we're going to have to. The House of Representatives at the national level is gridlocked, and they will not move until people start voting the obstinate people who are blocking these programs. They actually don't believe in helping people. And seniors cannot fend for themselves. I've got a really good example. Was on the platform committee for the Democratic Party, and we had a retired lady on the platform, and we were discussing what we would do for wording in the 2007-2008 financial crash. She was unaware it had happened because she got all of her pension payments and her home was paid for, and she didn't even realize it happened. She's 80 years old. Had she not had that type of a program, she would have been susceptible to losing her home, which would have caused immense problems for her. We need to look into those types of programs and expand them so that seniors are protected financially also. You know, expanding the federal programs at the state level, we're going to need to, because we cannot afford to put them all in nursing homes and leave them that way. It's just too expensive, and it's not a good quality of life for a lot of people.
So finally, if elected, what can seniors and adults with physical disabilities expect from you?
I will be an advocate for seniors with disabilities. I do not believe that they should be susceptible in our society just because they're not a fully capable, functioning, mobile person. They will need assistance. In our society today, there's a belief that everyone's independent and should be on their own. I don't believe that. We are our brother's keeper, and we need to look out for other people in our communities. With people working the way they do, you don't always know your neighbors anymore. And sometimes you just need a little bit of help to get by. Meals on Wheels, incredibly important program, needs to be funded. Transportation issues for people going to the hospital. I've been a volunteer at the VA for several years now, and I see the issues regarding disabled veterans. They do need help with things so that they can be functional, and they can't always afford them. So if we spread the expense of that across the board at the state level, their quality of lives will be improved.
Thank you, Mr. Mills, Democratic candidate for House District 18.
Thank you for having me, and thank you for your support.
I want to thank the candidates on behalf of members of Northwest Senior and Disability Service, Senior Advisory Council, and Disability Service Advisory Council for attending our candidates' interviews. Copies of these interviews are available from Northwest Senior and Disability Service by calling 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not necessarily endorsed by Northwest Senior and Disability Services. For more information about Northwest Senior and Disability Services, call 1-800-469-8772. The Advisory Council for Northwest Senior and Disability Services would like to thank CCTV for their production of this forum. Thank you for watching.